Welcome to this HealthShare online heel pain advisory clinic. The purpose of this presentation is to help you understand what could be causing your heel pain, the possible impact it may have on your health and function, and how you can best manage and improve your symptoms. Let's start by trying to understand a little about the foot by overviewing the anatomy. The foot and ankle form a complex system which consists of 28 bones, 33 joints, 112 ligaments. There is a lot going on in a very small area, so it is no wonder that sometimes things can go wrong. The foot has to undertake two very different functions. It is uniquely designed to be able to do this. It has to be both a rigid structure for weight bearing, but it also has to be able to conform to uneven surfaces and be flexible. The foot and ankle provide various important functions. These include supporting body weight, providing balance, shock absorption, and transferring forces coming from the ground, as well as the very important bones, joints and ligaments we have talked about. We should also mention the Achilles tendon. This attaches onto the back of the heel bone, or calcaneus, but fibres also spread underneath the heel bone toward the plantar fascia. The plantar fascia is a thick connective tissue which supports the arch of the foot and spans between the heel and the base of the toes. There are three bands, one toward the inside of the foot, one more centrally, and one to the outer aspect of the foot. The plantar fascia is closely linked to the Achilles tendon through the fibres which spread underneath the heel bone from the Achilles that I mentioned previously. The plantar fascia plays a key role in stiffening up the foot, enabling it to function as a rigid lever to propel through. As we walk and our heels lift, the plantar fascia tightens, providing support and making the foot into a rigid lever. However, as the foot leaves the floor, the pressure is released from the plantar fascia, turning the foot back into a more flexible structure, ready to accept any uneven surfaces again as the foot hits the floor. Because of the way that the plantar fascia and Achilles tendon works during walking, on every step there is 4 times your body weight in force going through the Achilles tendon and plantar fascia. This goes up to 8 times when jogging. It is therefore not difficult to see why these two structures are the most common causes of pain in this region of the body. Let's now look at the prevalence of heel pain within the UK. The first thing to say is that you are not alone. The heel is the most common place within the foot to experience pain. It is also the most common reason for somebody to see a healthcare professional about foot pain. Heel pain can affect one side or both. Of all causes of heel pain, plantar fasciopathy accounts for 8 out of 10 cases. And out of 10 people, one person will experience plantar fasciopathy in their lifetime. And although this is a common problem, we do recognise that this can significantly affect one's quality of life, causing stress and anxiety, impacting on your ability to continue with day-to-day activities. The symptoms of plantar fasciopathy are quite uniform in nature, in so much as most people tend to report similar types of symptoms. It is common for the first steps of the morning to be particularly painful. Pain will also be aggravated by prolonged standing or walking, particularly worse after periods of rest. You may also notice a change in your walking pattern to compensate for the pain. Let's look now at what causes plantar fasciopathy. It is thought that it is caused by repeated small overuse type injuries to the fascia near its attachment to the heel bone. This means that it is often not possible to pinpoint a specific point in time when the problem started. The position of the fascia, the type of material it is made out of, and the fact that it has a relatively poor blood supply means that sometimes the plantar fascia can struggle to cope with this overuse. It struggles to undergo a full healing response. This leads to less than ideal healing, which in turn leads to thickening, bruising, and a lack of organisation within the structure of the healing plantar fascia. We talked earlier about the considerable forces that has to travel through the plantar fascia when walking. This altered healing means that the new fascia is less able to cope with the demands placed upon it and thus struggles and becomes painful. It becomes easier to overwork, and people can get into somewhat of a vicious cycle where more and more simple tasks become increasingly hard. So let's now explore who gets heel pain. The general answer to this is that anyone can be affected by plantar fasciopathy. Elite runners will experience this if they do not manage their training properly. Excessive load can lead even the most healthy of plantar fascias to become painful. However, there are a number of factors that mean that your plantar fascia starts off less able to cope. As we age, the quality of our fascia reduces, making it more prone to pain. This is why people between 40 and 60 years old are more likely to develop this problem. Also, being overweight places more load through the plantar fascia and therefore makes it more likely to be painful. The body fat that we store can also have a wider effect. More on this later. Folk who usually have low levels of activity in their lives will have a plantar fascia relatively less well prepared for activity. So if activity levels are increased, even a bit, this can lead to symptoms. We've talked on a couple of occasions about the link between the Achilles tendon and plantar fascia. We specifically know that tightness within the calf muscles and Achilles tendon places greater load on the plantar fascia, meaning that people with tightness in these areas are more likely to overload the plantar fascia and more commonly have plantar fasciopathy. Also, people who wear certain types of shoes, such as high heels or particularly poorly supportive shoes, tend to experience more symptoms of plantar fasciopathy. This is due to the excess load that is placed through the plantar fascia. Although all of these issues can cause plantar fasciopathy, what tends to be the case is that all of these issues play a part and should be thought about when thinking about how to manage this issue in the long run. Diagnosis of plantar fasciopathy is clinical. We find tenderness on palpation of the heel area where the plantar fascia attaches to the heel bone. We find reduced flexibility in the ankle, particularly a reduction in your ability to move your toes or foot upwards. And we also see the common pattern of pain that we described earlier. These features are usually enough to come to a clinical diagnosis, although there are some clinical tests that can be useful. We often get asked about the use of imaging to diagnose, and as I suggested earlier, this is not the case. If we look specifically at the issue of X-ray in diagnosing heel pain, this is commonly now thought to add no clinical value. In the past, people have talked about heel spurs as being of relevance, although as this slide suggests, these can be present both in people with pain and people without pain. If we also take into account the fact that most heel spurs visible on X-ray do not originate from the plantar fascia, we can see that X-ray and heel spurs really add no value. So let's now look at prognosis, or how likely are you to get better? The news here is good. 8 out of 10 people are seen to completely resolve within a year, with only a very small proportion of people requiring treatment other than simple, good quality physical treatment and advice. So let's now look at what treatments are available. You may or may not have heard of NICE, the National Institute for Health and Care Excellence. These are a national body that looks at all the highest quality research and helps us clinicians to manage our patients in the best possible way by providing extensive guidelines. They have produced such guidance for the management of plantar fascia. Based upon the best evidence, NICE suggests that the first thing that should be done with the management of heel pain is to provide good quality education and advice, which is what this video hopes to do. There is also a place for pain relief, which we will discuss further later. Exercise is seen to be an important part of the treatment of plantar fasciopathy, with exercise helping to ensure the plantar fascia adapts and heals in a more resilient fashion, meaning that it copes better with life. A stronger and more resilient plantar fascia helps you get out of that vicious cycle that we talked about earlier. There is also a place for orthotics, insoles, or supportive footwear. These help to support your foot, reducing the strain on the plantar fascia so that you are better able to undertake your exercise. There is a very limited role, if these conservative treatments fail, in the use of what is termed as extracorporeal shockwave therapy. This uses shockwaves to the painful area, helping the body heal in a more complete way. It is the same piece of equipment that is used to treat kidney stones. Other than these treatments, there is a very small proportion of people that end up having corticosteroid injection, although this is not used routinely, as it is known to weaken the plantar fascia. On very few occasions, surgery may be indicated, but this is not a common intervention at all. Choice of footwear is key to managing symptoms of plantar fasciopathy. So let's explore what good footwear looks like. Footwear should not be cushioned, as this makes your foot unstable and therefore requires your plantar fascia to work harder. It needs to have a good heel cup, meaning the back of the foot should be held in a supported position. There should be a good heel drop so that the shoe is not flat. This means that the toes should be lower than the heel, as seen in the shoe in the picture. The sole of the shoe should be structured and supportive, helping absorb some of those ground reaction forces as we step. There should be laces fastening the shoe to hold your foot securely into the back of the shoe. And finally, there should be at least a centimetre from the end of your longest toe to the end of the shoe when weight bearing. Let's explore now some of the things that you can do to help yourself with plantar fasciopathy. Activity modification and pacing is important. Try to modify tasks to help reduce the factors that aggravate your pain. Break up activities into smaller chunks and try to space them out throughout the day. Try to take relative rest away from aggravating activities, reducing the things that provoke pain. However, try to avoid complete rest. The use of ice or cold to relieve pain can be of great benefit. Cold bottle rolling is a unique way of applying this chilling effect to the base of the foot. Fill a bottle, such as seen in the picture, with some chilled water and roll your foot over it, stretching the plantar fascia. Be mindful, if this has come straight from the freezer, you'll need to apply a protective layer between the skin and the bottle. And you probably shouldn't apply this for more than 15 minutes. Appropriate use of pain relief can be of benefit in aiding your recovery and enabling you to undertake your rehabilitation. Take pain relief regularly as advised, rather than as and when required. If you are not taking pain relief and you feel you need it, in the first instance, discuss over-the-counter medication with your pharmacist. And if your pain is not helped by over-the-counter medication, you can discuss this with your GP. There are also a number of lifestyle factors that affect the way you are going to recover from plantar fasciopathy. Smoking is linked with delayed and slow healing, poor tendon health and joint pain, so stopping smoking is an important factor in reducing pain, particularly from the plantar fascia. For further information, you can go to www.readytostopsmoking.co.uk. We discussed weight loss earlier and the effect that excessive weight has on increasing load through the plantar fascia. However, it is also understood that the extra body fat cells that we have in our storage of fat when we are overweight do not simply act as extra load. Fat cells circulate around your body and are known to affect inflammation within joints and soft tissues. Physical activity is an important way of maintaining resilience in the foot. Don't worry too much about undertaking activity that focuses specifically on your foot. Preferably, you should be doing something that you are enjoying so that you continue to do it. Recommendations for how much to exercise are for 75 minutes of vigorous exercise per week or 150 minutes of moderate exercise per week. Vigorous exercise is such that you will be out of breath and unable to talk in full sentences while undertaking it, so this may be a run, undertaking sport or stair climbing. More moderate activity will enable you to continue speaking and may simply be a walk, a cycle or a swim. It is also recommended that you do something to build strength or improve balance on a couple of occasions per week. The final tip that we have for you is be patient with yourself. Not everyone's journey looks the same. It might be that it takes a little time for you to see improvements. It is normal for your improvements to vary from day to day, and that will be influenced by a number of factors. You may find one day you feel worse, but this is okay as long as your pattern is for general recovery. Start small and gradually build. Small changes can make a difference. Below where this video is embedded on the web page, there are a set of exercises. So these next couple of slides we're going to talk about how to exercise and the principles with which you should guide yourself. Know that everybody is different and some exercises will work for you whilst others might not. Do more of what feels good. Start with finding a baseline of what you can currently do and then gradually build from there. Little and often is better to begin with, particularly if your heel is very sore. As you are able to do harder exercises, it might be that you reduce the amount of frequency with which you do them. So for example, you might start doing them 3 to 4 times a week, reducing to 2 times per week as they get harder. You can use the traffic light system to help guide the intensity and frequency of your exercise. This system helps you reflect on the intensity of your pain and your response to activity to see whether you have exercised at the correct level. First of all, think about your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. If when you are exercising your symptoms are provoked to a 0 to 3 level, and the pain settles quickly or immediately after exercise, you are exercising in the green zone. If your pain rises to a 4 to 5 out of 10 and takes a few hours to settle, you are in the amber zone. And if your pain is excessive, over 6 out of 10, and stays elevated for a number of hours afterwards, or at least into the next day, then you have over-exercised and are in the red zone. It is a good idea to start exercising in the green and move towards the amber. Exercising in the amber zone is perfectly acceptable, but if you find yourself drifting into the red zone, back off a little. Let's now address some practical questions. You should know that despite pain or movement restriction, it is not dangerous to move your foot, and it is unlikely to be causing you damage. Know that driving is usually fine as long as you feel your safety or control of the car is not limited by pain. Try to keep moving, participate in leisure and work activities where possible. Remember to modify your activity if it is painful. Try to do more of the pain-free activities and less of the painful activity. So in summary, heel pain is a very common problem. Your heel pain will improve in time. In the meantime, it may be helpful to modify your activities and to take pain relief. Exercises will also help your pain to get better. Use appropriate footwear and insoles if required. These will reduce the strain on your heel and allow it to heal. It is good to remain active and continue working while you wait for your heel to improve. If your heel pain does not improve as expected, please self-refer yourself online. Thank you very much for listening.